since COVID-19 struck in March and we went into lockdown, we had lots and lots of pregnant women that were really anxious. We decided to set up an Ask a Midwife service over Facebook, and we answered questions every day, put really important public health messages out. We noted that over 91% of the messages were actually answered by the Ask a Midwife Facebook service. There was no requirement for them to be referred into any other department in the hospital. We're able to prevent that by reassuring patients and actually giving them the answers to the questions that they wanted without a hospital attendance.
We're really lucky that we had a solid foundation to work on for our outpatient programme. We knew that virtual, from our experience, was going to be a vehicle that would keep patients safe. We were one of the first to pilot the Microsoft Booking app, which turns Microsoft Teams into a patient-facing application. And we tested the functionality, the accessibility, the ease of use over a few days with over 100 patient volunteers adapting it to their feedback.
Prior to the pandemic, all the hospital notes were still on paper. Using electronic records meant that we were able to view the records before we went on the ward, so we were spending less time on the ward, so there was less risk of infection transmission. The second thing that we developed was video appointments, which we were already using in one part of our service. We were able to extend that into other areas, such as swallowing assessments for people in their own homes.
We're using remote technology at the moment to support patient flow through our stroke pathways across the region. And what it's allowed us to do is, where there's been a really complex case, using Microsoft Teams or using video calls, we've been able to work together across the region to problem solve and come up with solutions and overcome some of the delays that we might have experienced as a result of COVID-19.